Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant content, as well as updates on current hair loss treatments in the pipeline. So I've actually been away from social media for about a month or so, and I just wanted to let you guys know that everything is okay. I recently moved to a new house. I am still in Virginia, but that also meant that I had to put up my old house for sale, and with the whole moving aspect, I was just extremely busy. And also with having 2 kids, I was unable to, publish new content, but I am happy to say that I am all settled in and will try to give you guys weekly content on YouTube. So today's video topic is something that a few of you asked me to cover, and it's actually a pretty interesting and hot topic in the hair loss community. Company is called Pelage Pharmaceuticals, and they are a biotech company that spun out of UCLA. The researchers there discovered that 2 topical compounds, RCGD423 and UK5099, basically increases and activates lactate production in the hair follicle stem cells of mice, resulting in accelerated hair growth. Now, instead of blocking hormones like 5-AR inhibitors or stimulating blood flow through Minoxidil, this topical treatment, which has been refined to be known as PP405, inhibits the mitochondrial pyruvate carrier, which boosts lactate dehydrogenase activity, or LDH, and thus triggering stem cell proliferation in the hair follicles. Now, with this, they conducted a phase 1 clinical study in 2024, and data did show that in human facelift skin, single topical applications of 0.006% and 0.06% PP405 led to an increase in LDH activity in the hair follicle stem cells within 24 hours. LDH activity corresponded with a significant increase in Ki67 signal in the hair bulge. Increase in Ki67 levels are associated with hair growth, indicating a proliferative response of the hair follicle stem cells. The findings did demonstrate proof of mechanism in human explanted skin, consistent with the results in the animal models. The data from phase 1 clinical trial concluded that PP405 was safe and well tolerated with the targeted pharmacokinetic profile achieved. Additionally, the phase 1 study demonstrated proof of mechanism and target engagement in patients with androgenetic alopecia. Now, there was a statistically significant increase in the Ki67 compared to baseline after just 7 days of 0.05% PP405 topical treatment. Evidence of newly emerging hair germs, the hallmark of the telogen to anagen transition, was also observed. Topical molecule also received positive formulation reviews from patients. And then more recently, we got results from phase 2A clinical trial results for PP405, consisting of 78 men and women with androgenetic alopecia. Now, the subjects did apply 0.05% PP405 or a placebo on their scalp once daily for 4 weeks and were followed out to a 12-week study. The study met its primary safe point endpoint and secondary pharmacokinetic endpoint. Drug was well tolerated with no systemic absorption of PP405 detected in the blood, underscoring a robust safety profile. Exploratory endpoints assessed early signs of new hair growth. Now, preliminary results from 1 month of treatment showed a rapid and statistically significant clinical response. At just week 8, only 4 weeks after the completion of treatment in men with a higher degree of hair loss, 31% of those treated with PP405 exhibited a greater than 20% increase in hair density compared to 0% of patients responding to the placebo group. Visible hair regrowth requires, at least 6 to 12 months of continuous therapy, suggesting that PP405 is going to yield a more rapid clinical response than current treatments. Particularly striking was the finding that unlike the current existing drugs that primarily slow down hair loss or support hair growth from already active follicles, PP405 induced new hair growth from follicles where no hairs was previously present, offering early validation of its regenerative potential. So this obviously is extremely positive news. Not only do we have a topical application treatment that is not going to go systemic, we also know from phase 2 results that after just 4 weeks of treatment, that's just 1 month, over 30% of patients had greater than 20% increase in hair density. So imagine, just 1 month of topical application and having just this much of an increase in density. It's actually just unheard of, and this is all without systemic side effects. The other good news is that 0% of the patients in the placebo group did not have any results showing that PP405 had significant impact to the treatment group versus the control. Now, Pelage is expecting to begin their phase 3 clinical trial in 2026. So they are moving pretty rapidly, and given the positive results from PP405, They also are likely to not have any issues with funding. There's a lot of investors interested in this company, and previously they were able to secure nearly $20 million in Series A financing a few years back. So overall, I think PP405 does really have a lot of potential. It works, in a different mechanism of action to stimulate hair growth, and would definitely, if successful, would go hand in hand with a 5-AR inhibitor like finasteride or dutasteride, and minoxidil, and even an anti-androgen for maximum hair growth and hair loss prevention. Now, whether this will actually be successful, in terms of commercialization is going to be another story. But the molecule itself and the mechanism of action appears to be very promising based on the results that we've seen from phase 1 and phase 2 clinical studies. And, I think that this does show that, dormant hairs aren't fully going to be dead, but instead just need some type of reversal of miniaturization to really bring back, from the hairs from the telogen to the anagen phase of the hair cycle. I don't think that this treatment is going to be, per se a cure to hair loss, but, I think it would definitely complement other hair loss treatments. But I really do hope that we can see some long-term studies on PP405 because, 1 month, to be honest, is relatively a short period of time to, just really determine whether a drug's efficacy, if a drug is going to be efficacious, and obviously a larger sample size is going to be warranted. I'm also curious to see the efficacy from a long-term standpoint. We don't know the long-term impact of modulating stem cell metabolism in the scalp. With any stem cell targeted treatment, there's always going to be a risk of this, dysregulation, especially from prolonged use. Long-term could also mean potential systemic side effects. So this is something that we need to really consider as well. Things like what's going to happen if it actually does go systemic, what are going to be the side effects, how it's going to affect our health. But all in all, I'm pretty excited about this. I'll keep an eye on it for any updates. Let me know in the comments what your thoughts are on PP405. But until then, thanks for watching, guys, and I will keep you guys updated. Take care.